Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Spatial frequency domain imaging, non-invasive approach to monitor postprandial cardiovascular health. The dynamics of blood nutrient and lipid levels after consuming a high-fat meal are crucial indicators of both current and future cardiovascular health. A promising non-invasive approach to measure these circulating substances is a non-contact optical imaging technique called spatial frequency domain imaging, which quantifies tissue properties and hemodynamics. A recent study from Boston University, Harvard Medical School, and Brigham and Women's Hospital investigated how meal composition affects skin tissue properties shortly after eating. As reported in Biophotonics Discovery, the research team focused on the peripheral tissue of the hand to understand the immediate impact of low-fat and high-fat meals. Using spatial frequency domain imaging, the researchers monitored 15 subjects who consumed both types of meals on separate days. The team imaged the back of each subject's hand hourly for 5 hours post-meal, analyzing 3 specific wavelengths to evaluate hemoglobin, water, and lipid concentrations. Validating children's pain. Untapped approach to prevent chronic pain. In a new study from the University of Australia, researchers say that parents and doctors should be mindful of how they talk to and treat children experiencing pain. No matter how big or small the injury, knowing that these foundational experiences can be carried forward into adulthood. Drawing from diverse research across developmental psychology, child mental health, and pain sciences, researchers say that it may be important to validate children's pain by demonstrating that their pain-related experiences, emotions, or behaviors are acceptable, understood, and legitimate. By validating a child's pain, the child feels heard and believed, which reinforces their trust and connection with their parent or with a treating doctor. When a parent or doctor validates a child's experiences in a way that matches their expressed vulnerability, it helps the child to feel accepted, builds connection and trust, and may help the child to develop critical skills in regulating their emotions. UniSA researcher Dr. Sara says. Association between autoimmune conditions and premature ovarian insufficiency human reproduction study. The research, published in Human Reproduction, is the largest to investigate the link between autoimmune conditions and premature ovarian insufficiency and has followed nearly 20,000 women. The researchers say their findings significantly strengthen the hypothesis that autoimmune process plays a pivotal role in onset of premature ovarian insufficiency. Dr. Susanna Savukoski, a gynecology and obstetrics doctor at Oulu University Hospital and University of Oulu, Finland, led the study. She said estimates of the prevalence of premature ovarian insufficiency of autoimmune origin have ranged from 4% to 50%. Our study has found that autoimmune diseases were 2 to 3-fold more common in women diagnosed with premature ovarian insufficiency at the time they were diagnosed, and incidence of these diseases was 2 to 3-fold higher during the first years after being diagnosed with premature ovarian insufficiency compared to a control group of similarly aged women from the general population. The incidence was higher than in the control group even more than a decade after being diagnosed with premature ovarian insufficiency. Single-dose gene therapy shows promise in reducing bleeding episodes in hemophilia patients. Adults with hemophilia B saw their number of bleeding episodes drop by an average of 71% after a single infusion of gene therapy, according to the results of an international phase 3 clinical trial published in the New England Journal of Medicine by researchers from the University of Pennsylvania, Perelman School of Medicine, and a multi-center group of investigators. What we saw from patients in this study was that within a few days of receiving the gene therapy infusion, it took root and their bodies started making factor IX for the first time in their lives, said study investigator and lead author Adam Kuker, MD, MS, Section Chief for Hematology and Clinical Director for the Penn Blood Disorder Center and the Penn Comprehensive Haemophilia Program. We always want to be careful about using the word cure, especially until we have longer follow-up data, but for many of these patients, it's been life-changing. Based on the results of this study, the FDA approved gene therapy in April 2024. Kuker was the site lead for the clinical trial at Penn Medicine, which was one of the top enrolling sites for the study. It represents the second form of gene therapy approved to treat Haemophilia B. The first such therapy was approved in November 2022. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.